Happy and healthy altitudes to you. Hello, I'm Gary Giannetti, and I'm coming to you from Healthy Altitudes, Colorado.
Hi, everybody. It's Dr. Matt coming to you from sunny North Carolina today in your peak mind. It's great to be here today. Today, Gary, I want to talk a little bit about your mental position at the same time as what that can do as far as your exercising goes. And so I think I'll start us off today, if that's okay with you, Gary, and talk about the idea that, in an age, and everybody goes right down to Corona, but in an age where we're always looking for quick fixes to things, and I feel this way, so let me take a pill for that, or I want to feel differently, so I'm gonna smoke this, or whatever. Those are quick fixes. The interesting thing is physiologically, our bodies actually already have all the chemicals that we need to feel whatever way we want to feel. And for people out there that might be a little bit depressed or might be a little bit anxious, especially during stressful times like the one that we're in right now, the anxiety that's being caused or the depression that's being caused is something that we're more sensitive to today. And so we're trying to talk to our primary care physician. What can I take? I'm being sad a lot more often than I was before. I'm quicker to anger than I was before. I'm sad. I'm just not happy with my life right now because I'm feeling so isolated. Perhaps Gary, you've seen some people that you've talked to about that already in your practice as well. Have you talked to someone about that?
Yeah. Oh, yeah. Yeah. I mean, I've had folks say how they're really depressed, and then they go out for a walk or they go for a run, and they feel better. I think we were talking about this a little bit beforehand. Everybody has ups and downs in life. No matter what, we all have tendencies to be depressed at times. If something bad happens, you get depressed. That's a normal reaction. But the chemicals in our body, like you said, bring us back to what we need to do to rebalance, or can help us do that.
Well, there's a little secret that a lot of people don't know about, and I'm going to tell it to you right now, especially if you're watching us from wherever you're watching. This is a secret weapon that you come fully equipped with your body. And I think Gary can talk about this a little bit more from a fitness standpoint, but from a psychological standpoint, here's the secret. You ready?
I'm listening.
You cannot be depressed and exercise at the same time. Your body doesn't allow it. You can't let the chemicals that create depression and the chemicals that create happiness, they only flow at one way at a time. So the neat thing is if you're actually exercising, and I'm not talking about hard, you're running 300 laps, you're sprinting 300 miles and that sort of thing. I'm talking about just simple exercise. If you're exercising, you cannot physiologically feel depressed at the same time. You cannot physiologically feel anxious at the same time. Your body goes into one mode, and you basically are feeling better. If you were feeling depressed, you don't feel depressed anymore for a while. If you're feeling anxious, you're not feeling anxious anymore for a while. Your body, because of what happens with your body physiologically when you're exercising, you don't feel those same negative feelings anymore. So something that you could do, if you're feeling a little bit down, especially during the age of COVID, or maybe you have a stressful time at your job, or even when COVID's gone, hopefully soon, and you're still feeling a little bit down sometimes, you can actually engage your body to get yourself out of that mood. And a lot of people don't know that. They think a lot of times they've got to grab for a pill or grab for some medication, and sometimes that is necessary. Don't misunderstand. But in times when it's an everyday run-of-the-mill kind of, man, I just feel kind of down today, a really great way to get yourself out of that is just to get yourself exercising.
Yeah, I think absolutely. And I think, we talked a little bit about what amount of exercise do you need to reach that. And I think it is very similar to a drug. Again, if you take medications for depression or anxiety, keep taking them, ask your doctor and work with your doctor to fit exercise in. But I've never met a doctor who said, don't exercise to help your depression. Every doctor will always tell you exercise can only help. Unless maybe there's an eating disorder and you don't want people over exercising and things like that. However, for most people, it is a dose-response relationship, like a medication. And we talked about how you have to build up a therapeutic dose. And I think that that's something important where once you start doing exercise regularly, and we talk about that in our other talks, how you build something into your lifestyle regularly, then you figure out, okay, I need 10 minutes at this intensity, and then I feel better for the whole day. I get a runner's high. The endorphins kick in, and they last for how long. And you start to feel that out, and you know you feel better. So whatever the dose is based on what the response is. And they can kind of interact back and forth. You might need 10 minutes of a real high intensity interval training workout, or you just might need a walk outside, like you said, or a walk around your house as a brain break from being on a screen a lot. And so I think that, like you're saying, Dr. Matt, I mean, it is something you always want to talk to your doctor about, but exercise is one of those things, you know, and in my job, at least as a personal trainer, if I'm just focusing on exercise with people, teaching classes, teaching exercises, I've had so many folks come in and they say, oh, I really don't want to work out today. I really don't want to work out today. But like you said, they never, at the end, I would almost say never, ever say, oh, I really wish I didn't do that. I don't think I've ever heard someone say, I wish I didn't do that after they work out, because people always feel better after they exercise. Even if it's at a low intensity, people still feel better. So from a depression standpoint, I've heard several people during this COVID thing saying how they're getting depressed, or they're spending too much time inside, or they're not happy. And I encourage a lot of folks, hey, get outside, just go walk. We've actually cut our workouts from the standard 1 hour workout to 30-minute workouts. And I'm focusing on reminding people to go use the other 30 as an opportunity to get outside and get fresh air in the other 30. It cuts my time down with people, but I'd much rather see people happy outside. So exercise is, as the American College of Sports Medicine said a couple of years ago at their annual conference, exercise is medicine. And it's one of those things that really can benefit people once you can find your therapeutic dose and keep doing it regularly. So another reason to keep doing it for your life, you know, being active for your life to stave off depression.
There you go. So just in an effort to give you a quick summary then, if you're not feeling maybe on top of the world, maybe you're feeling a little bit of depression, get out there and exercise a little bit. It can actually help you feel a lot better about things. But let me give you one quick caveat, and that is if you've been diagnosed with a depressive disorder and you're taking medication from a physician or from a psychiatrist, continue doing that. This is not to replace that kind of activity, but you may eventually be able to stop taking it if you get yourself into a wonderful exercise regime. This is something to talk with your physician about, something to talk with your therapist about. So in a nutshell, exercise good, right? That's all I want you to know. Exercise is good.
Yeah.
And you're not able to feel depression while you're exercising. So just short little note for you today. That's it. And I hope you're doing great today and having a good Mother's Day weekend. So
yeah.
Thanks,
Dr. Matt. Thanks. And we look forward to making some more of these in the future, helping people be active, eat well, and stay happy, not just because of COVID, but for your life.
For your life. Thank you.
Thank you, Dr. Matt.